Welcome to Final BDS Made Easy. In this video, we are going to discuss the one-marker questions from the subject of Orthodontics and Dentofacial Orthopedics. The question is, what is reverse piezoelectricity? When a crystal structure is deformed, electrons migrate from one location to another, resulting in an electric charge. As long as the force is maintained, the crystal structure is stable and no further electric effect is observed. When the force is released, the crystals return to their original shape and a reverse flow of electrons is observed. Number 2 is enumerate different types of headgears. Based on the site of anchorage, these are cervical, occipital, combination, vertical pull headgears and asymmetrical headgear. What is cortical anchorage? Cortical anchorage involves utilizing the dense cortical bone as a point of resistance in orthodontic treatments. This is achieved by placing orthodontic mini implants or screws into the cortical bone, which offers greater stability and minimizes unwanted tooth movement. This technique is particularly useful in cases requiring significant anchorage control. Number 4 is classify crowding. It can be classified as simple and complex crowding. Simple crowding is defined as the disharmony between the size of the teeth and the space available in the alveolus with no skeletal, muscular, or occlusal functional features. Complex crowding is defined as the crowding caused by skeletal imbalance, abnormal lip and tongue functioning, and/or occlusal dysfunction, as well as disharmony between the sizes of the teeth and the available space. Then there are primary, secondary and tertiary crowding. Primary crowding refers to the crowding caused by the genetically determined size discrepancy between the teeth and the crown. Secondary crowding is the shortage of space that can manifest after extraction of deciduous teeth through migration of neighboring teeth into the open space. Tertiary crowding refers to irregularities developing in the mandibular and sometimes slightly in the maxillary anterior region during early adulthood and later. Next are hereditary and environmental. Hereditary factors include evolutionary changes, which include progressive reduction in the jaw size as compared with the tooth size. And environmental factors include prolonged retention of deciduous teeth, reduction of arch length due to interproximal caries in the primary teeth, etc. Number 5 is explain two conditions which require permanent retention. First is when arch expansion is achieved without ensuring good occlusion. Second is severe rotations. Other conditions which require permanent retention are generalized spacings and midline dystema. Question number 6 is classify crossbites. Crossbite can be classified based on location as anterior tooth crossbite and posterior crossbite. Anterior crossbite can be further classified as single tooth or segmental, and posterior crossbite are further classified into unilateral and bilateral. Based on the nature of the crossbite, they can be skeletal, dental, or functional crossbite. Limitations of lateral cephalogram. It cannot provide information on the depth or the 3D structure of craniofacial anatomy. Overlapping structures can obscure or distort anatomical details. Differences in magnification can affect measurement accuracy, and it only offers a static view, lacking functional or dynamic information of jaw movement. Number 8 is anterior single tooth crossbite. Single-tooth anterior crossbite is a condition where there is overlapping of one of the mandibular anterior teeth over one of the maxillary anterior teeth. CSF in orthodontics. Perisation or circumferential supracrestal fibrotomy, as it is often called, is a minor surgical procedure that is undertaken to counter the relapse tendency of the stretched gingival fibers following the correction of rotations. With suprasal versus the A and B angle. A and B angle, this angle is found by the intersection of lines joining nasion to point A and nasion to point B. It denotes the relative position of the maxilla and mandible to each other. The width appraisal is a measure of the extent to which the maxilla and mandible are related to each other in the anteroposterior or sagittal plane. The width appraisal is used in cases where the A and B angle is considered not so reliable due to factors such as position of nasion and rotation of the jaws. Question number 11 is lip bumper. Lip bumper or lip plumber as it is sometimes called is a combined removable fixed appliance. The lip bumper can be called a modified vestibular screen that is used for muscular force application or force elimination. The appliance can be used in both the maxilla and the mandible to shield the lips away from the teeth. Question number 12 is CBCT in orthodontics. Cone beam computed tomography is a valuable imaging tool in orthodontics for obtaining detailed three-dimensional images of craniofacial structures. It provides accurate information about dental and skeletal relationships, aiding in treatment planning for orthodontic procedures such as assessing impacted teeth, evaluating airway dimensions, and planning for orthodontic surgery. Next question is Delaire's face mask. This was popularized by Delaire in the 60s and uses the chin and forehead for support. The appliance is made up of rigid wire framework which is squarish and kept away from the face. It has a forehead cap and a chin cup with a wire running in front of the mouth used for elastic attachment. Next question is interproximal reduction. It is a method by which the proximal surfaces of the teeth are sliced in order to reduce the mesodistal width of the teeth. It is also known as reproximation, slenderization, disking, and proximal slicing. Question number 15 is BSSO. It is a surgical procedure used in orthodontics and dentofacial orthopedics to reposition the mandible. It involves making a bilateral cut along the mandibular ramus and repositioning the lower jaw to correct severe cases of skeletal malocclusions such as mandibular prognathism or retrognathism. This procedure helps in achieving improved facial aesthetics, occlusal function, and overall stability of the jaw position after treatment. Next question is optimum orthodontic force. Optimum orthodontic force is one which moves teeth most rapidly in the desired direction with the least possible damage to tissue and with minimum patient discomfort. Oppenheim and Schwartz, following extensive studies, stated that the optimum force is equivalent to the capillary pulse pressure, which is 20 to 26 grams per centimeter square of root surface area. Next question is Jackson's triad. It comprises of structural balance, aesthetic harmony, and functional efficiency. Next question is incisal liability. During the first transitional period, the deciduous incisors are replaced by the permanent incisors. The permanent incisors are considerably larger than the deciduous teeth they replace. This difference between the amount of space needed for the accommodation of the incisors and the amount of space available for this is called incisal liability. Incisal liability is roughly about 7 millimeters in the maxillary arch and about 5 millimeters in the mandibular arch. It was described by Warren Main in 1969. Space maintainer. According to Boucher, it is a fixed or removable appliance designed to preserve the space created by the premature loss of a primary tooth or a group of teeth. Next question is Meckel's cartilage. The Meckel's cartilage is derived from the first branchial arch around the 41st to 45th day of intrauterine life. It extends from the cartilaginous otic capsule to the midline or symphysis and provides a template for guiding the growth of the mandible. A major portion of the Meckel's cartilage disappears during growth and the remaining part develops into the following structures: the mental ossicles, incus and malleus, spine of sphenoid bone, anterior ligament of malleus, phenomandibular ligament, and the lingula. Number 21 is leeway space. The second transitional period is characterized by the replacement of the deciduous molars and canines by the premolars and permanent cuspids respectively. The combined mesodistal width of the permanent canines and premolars is usually less than that of the deciduous canines and molars. The surplus space is called leeway space of Nance. The amount of leeway space is greater in the mandibular arch than in the maxillary arch. It is about 1.8 millimeters in the maxillary arch and about 3.4 millimeters in the mandibular arch. This excess space available after the exchange of the deciduous molars and canines is utilized for mesial drift of the mandibular molars to establish class 1 molar relation. Question number 22 is Hellenization. Hellenization refers to the process where the periodontal ligament fibers lose their cellular components and become hyalinized due to prolonged and excessive orthodontic force application. This occurs when the blood supply to the periodontal ligament is compromised, leading to necrosis and subsequent hyalinization. It is a concern during orthodontic treatment as it can delay the tooth movement and may lead to root resorption if not managed properly. Treatment involves adjusting forces to avoid prolonged pressure and maintaining good oral hygiene to support periodontal health. Next question is myofunctional appliance. Functional appliances are defined as loose-fitting or passive appliances which harness natural forces of the orofacial musculature that are transmitted to the teeth and alveolar bone through the medium of the appliance. Number 24 is the activator. Activator is a loose-fitting appliance which was designed by Anderson and Hopple to correct retrognathic mandible. The appliance opens the bite and the mandible is advanced for class 2 correction. Question number 25 is crossbite. Crossbite is a term used to describe abnormal occlusion in the transverse plane. Question number 26 is headgear. Headgears are the most commonly used extraoral orthopedic appliances. They are used during the growth period to intercept or correct certain skeletal malocclusions, as well as to distalize the maxillary dentition or maxilla itself. Headgears also form one of the important adjuncts to control or gain anchorage. They derive anchorage from the cervical or the cranial regions. Question number 27 is welding. Welding involves the joining of two or more metal pieces directly under pressure without the introduction of an intermediary or filler material. Number 28 is buccal tubes. The attachment that is generally used on the posterior teeth is the buccal tube or the molar tube. The buccal tube can be weldable, in essence welded to bands which are cemented around the teeth, or they can be bondable, that is attached directly to teeth by using bonding adhesives. Buccal tubes can be round or rectangular in cross section. The buccal tube may sometimes have double or triple tubes. These additional tubes are for additional arch wires and for facebo insertion. Question number 29 is self-correcting malocclusion. Anomalies which arise in child's developing dentition during the period of transition from pre-dentate period to permanent dentition period and get corrected on their own without any dental treatment are called self-correcting anomalies. Question 30 is width appraisal. It is intended as a diagnostic aid whereby severity of degree of anteroposterior jaw disharmony can be measured on lateral cephalometric head film. WITS is an abbreviation of University of Witwatersrand, Johannesburg, South Africa. Question 31, retention. Retention has been defined by Moyers as maintaining newly moved teeth in position long enough to aid in stabilizing their correction. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.